Hello and welcome from Healthcare Authority. Thanks for joining us on this webinar about reconciliation. 4 questions today. Please use your panel and submit questions electronically. We will copy those down and address them as they come. And additionally, when we get to stopping points, we will open up for questions. I do want to remind everybody that's on the phone, this is for our auditors and FQHCs. At this point, we don't have any managed care organizations or other types of organizations on the line. So this webinar is for reconciliation. I do want to call out for those participants that are APM4 participants. This is for financial reconciliation only. We are not going to be talking about quality performance pieces during this webinar presentation, though we will talk about a little bit later in the agenda some specific nuances for APM4 participants. I would like to do a quick round of the room on who is in the room today. So my name is Gary Swan. I'm the lead on APM4 and work with our finance team that will be hosting this webinar. So today in the room we have
Patrick Miles. I'll be talking a little bit about enhancement data and how you will receive that from us when it comes time for you to start looking at that reconciliation piece.
And Medina Cavendish.
And Michaela Snook.
So again today, we're really here to make sure that everybody understands how to populate the template for reconciliation and to address some of the common issues that we run into from a finance side on resolving some of those pieces of information and to address your questions. And then on the back end of the conversation, we're going to touch on some specifics for APM4 participants. So I'd like to hand it over to Medina Cavendish to go over a little bit more about why we're here.
Hi, everyone. Thank you so much for joining us on this webinar. So the purpose of this reconciliation overview is really provide you with a kind of a high-level understanding. We understand that the reconciliation process is very complex. A lot of details go into it, and we're not able to address every issue in detail. So this is a very high-level overview. But if your clinic has a specific question that is maybe unique to that clinic, we encourage you to reach out to us directly by emailing to fqhcrhc@hca.wa.gov, and we'll be happy to set up a phone call with you. So this time we wanted to talk to you about some of the kind of commonly seen issues that we've encountered on our part when we receive reconciliation summaries and AUPs from FQHCs and auditors, because we're hoping that if we can address those issues beforehand, that we'll be able to facilitate the review and finalization of the process much more smoothly and reduce some of the back and forth between HCA and FQHCs and auditors. We are facing pretty tight turnaround times for submitting reconciliations to HCA this fall, so we wanted to kind of address some of these issues, preventable issues, to make sure that we finalize reconciliations in a timely manner. And towards the end of the presentation, as Gary mentioned, there will be a couple of slides specific to APM4 participants. So clinics that are not participating in APM4 will have an opportunity to sign out because we want to be respectful of your time. So a little bit about the reconciliation timeline for FQHCs. HCA will provide detailed enhancement data to FQHCs in the following manner. For APM4 participating clinics, they will receive their enhancement data by mid-July 2018, and Patrick will speak a little bit more in detail on that. And for APM3 clinics, they will receive their enhancement data by mid-August 2018. FQHCs that participate in the APM4 pilot, as per the Memorandum of Understanding signed by those FQHCs and HCA, will submit their reconciliation for 2017 by September 30th, 2018. For APM4 3 clinics, the deadline is November 30th, 2018. And of course, if you happen to finalize your reconciliation before that, we'll be happy to receive it prior to those due dates. At this point, I'm going to turn the presentation over to Michaela Snook, who will walk us through the reconciliation template piece by piece.
Good afternoon. The first slide is just kind of to give you an example of what the template looks like. A lot of the clinics and auditors on the call probably are familiar with the template, and you probably all know it as well as we do, but we know that some clinics have had turnover, and also we have some different requirements this year, or some minor changes in what we're asking for. So that's why this is important. It also, going through this template is going to save time and resources by providing accurate templates to HCA in a format in which we can review. So this is kind of a high-level overview of the template, and we ask that you please provide the template in Excel format so that we can look at your data quickly and make sure that all your formulas are working within the document when you submit it to HCA. This slide does contain one change that is new for 2017 reconciliations. HCA will be requiring FQHCs to report all NPIs that were included in your reconciliation data. And we ask that you only include NPIs associated with your FQHC status. We know that some FQHCs have many NPIs associated with their FQHC status, and you may submit those in a separate Excel worksheet if needed. So this is to give an example. You can see in red as we go throughout this will be the cells that we're focusing on for this slide. In cell 1A and 1B, you'll put your FQHC name and then your FQHC clinic NPIs, which are associated with your FQHC status. If you have more NPIs than will fit on the template, you may submit them in an Excel spreadsheet along with your template. So for those clinics that have had a change in scope or a rate change during the reconciliation time period, these rate changes should be clearly identified by date and broken out on separate reconciliation templates based on the correct rate period, for example, which means essentially the rate effective date. All encounters and enhancement payments for those should be attributed to an AUP spreadsheet with the corresponding date span. If you have questions about what your encounter rate was or you're not sure, there are two things that you can do. First, HCA would ask that you look on HCA's website at the biller and provider webpage where we post publications and look for your rates there. They're updated as often as the rates may change, but as frequently as quarterly. You can also ask HCA if you see some sort of issue on the posted encounter rates, and we can verify those rates for you as well. So when you put a rate in, you'll put it into section 1, number 5, and your rate period will include the beginning and end date. In this case, the rate was from January 1st to May 1st. And this clinic experienced an encounter rate change that was effective on May 2nd. So then the clinic would submit a second template for May 2nd through December 31st of that year. For the payers that are to be included, we did see several different variances on which payers were reported. So we thought we would clarify who we expect to see as payers on your reconciliation template. These will be the Medicaid Managed Care health plans that are listed here. And for each of those plans, please only include the listed programs below: AHAC, HOFC, HO, HOBD, SCHIP, and FINC. Please don't include any other sorts of payers, like vision payers. Those are not included in the reconciliation. This year, we have simplified the template. You don't need to break out your template based on program code. You can just do the MCO and kind of group that whole MCO together. And that makes it easier for us and hopefully for each FQHC. If you have a reason to break them out by program code, you can, but we'd prefer it to be in this format. So you'll break out your maternity visits from other qualifying encounters. And then once we get those, HCA will do an in-house verification with Managed Care Provider 1 data to provide an estimate to us to make sure that the encounter data matches with what we have. For physician schedules, you can find them at the HCA publications page. The physician schedules are updated January 1st and July 1st of each year. Something that's new to 2017 is that the EPSDT schedules are now located in their own folder on the publications page. This occurrence happened in July of 2017, and they will be posted each year in January and July. So for the first half of 2017, you'll still find the EPSDT codes in the physician's fee schedule. You'll also find professional administered drugs. I believe they used to be called injectables. They're now called professional administered drugs, and those are also found at the same location. And those are updated quarterly. And this box highlighted in red is where you will put your fee-for-service amounts. And they will be broken out by NCO. For pharmacy will be reported in your reconciliation template unless you are an FQHC who has rebased and removed pharmacy. In that case, you will not need to report pharmacy payments in your template. H is where you will report your pharmacy data.
Good afternoon, everyone. This is Patrick. I want to take a few moments to go over some of the enhancement data that you're going to start receiving from us. Everyone should have already received their 2014 through 16 enhancement data and detail files. If you have not, please reach out to us so that we can provide that to you again. This would have been uploaded to the SFT site, which you should be familiar with as well. We have started pulling together the enhancement data for calendar year 2017, and this includes all retro adjustments made through June 2018. HCA is no longer accepting enhancement or roster data for calendar year 2017 so that we can complete this process timely. The 2017 enhancement data will be sent by the end of August 2018 for both APM4 and APM3 clinics. APM4 clinics should expect it by the mid of July, so that's in the by the end of next week is when I'm hoping to have all of that completed. And APM3 clinics should be able to receive theirs by mid-August, but at the latest, end of August, everything should be completed. HCA will be assembling these enhancement data summary in a way that is easy to follow and understand, and I will be going over what that looks like here in the next few slides. Each clinic can expect to get their clinic-specific summaries and detailed files uploaded to the SFT when they are completed. So to look at the enhancement data, this is what the header will look like, and you'll see here that it says January through December 2017. And what we're looking at for January, the payments and adjustments shows the dollars per month based upon monthly and retro rosters. So January, you're going to see the $23,016 paid out, but we had adjustments of $900. That includes current and retro rosters that have been submitted throughout periods. So when you look at your actual January summary that I sent out for January of 2017, that number likely will not match what you're seeing here because of the fact that we have received retro rosters, which will both remove and add clients to various months throughout the year. And when you look across at the end for the grand total from January through December on that very first line of payments, and then you do the same thing for adjustments, you look at the line below that, the yellow box highlighted with the red outline, you'll see the total dollars that you received for the year for each of your assigned clients. When you look at the next section down below with your enrollments and disenrollments, it's the same concept. In January, you had 500 clients assigned and 7 clients who were disenrolled from your clinic. And again, this includes all clients who have been assigned and unassigned throughout the year. So when you look at the end of the year, you'll see your total enrollments, your total disenrollments to get you a final number of the 5766 that I have highlighted in yellow. When you get those final numbers that, I'm going to go back one slide here. So you look at that $287,000 that I have for your total payments. You'll see here highlighted in the red cells in column G, that $287,000 total paid by state. That is the number you're going to receive. You're going to enter that same number from the enhancement summary that I send you. The next piece of information that you're going to look at with this enhancement summary, this will be farther down the same page of what we just looked at. And we're looking at the first 4 months of enrollments for this particular clinic, which is all just made up data that I use for this purpose. And what I want you to look at here is down below, I have kind of given a definition and understanding of how we've come to this data. So where we have payment months, that's showing January of 2015, which was what I had for this particular mock-up. And then we have roster month is November 2014. It's important to remember that there is a 2-month delay of when the rosters are assigned and when the clinic receives the money. And we are looking at your payment month for reconciliation purposes. The next column is your MCO name. So if you have all 5 MCOs or if you have 2 MCOs, that's what you're going to see listed here. So in this case here, I used an example that had 4 MCOs. Next, we're going to look at rates, and you're going to see that this clinic's made-up rate is $25.50. And then we have it broken out by each program that clients would be assigned. So looking at AMG, there were 2,000 AHAC clients. You look all the way to the right under the grand total column, and you'll see that we've added up all of the program enrollees to a grand total of 3,100 clients. You multiply that number by the 2550, and you're going to get a payment total that the clinic has received from AmeriGroup for the month of January. That number will match the summary that you're seeing well, the entire month of January that you're seeing here, all of AmeriGroup through United Healthcare will match the same number that you will have in your January summary up above, minus the disenrollments, which would be farther down on this page. But that will match what the payments section would be. Now you'll look next to that grand total, and that is the number of clients assigned, which is what's used in the lower section of the header that we looked at in the previous slide. And any questions that you have on this, I'd be happy to have a conversation with you and go into this with more detail. But again, this is how these summaries are going to look. So you'll want to make sure that if you do have any questions and you want to follow it, then please reach out to us so that we can provide clarity. One thing you'll be able to do with this is this will be coming in an Excel file. So you'll be able to click on each of the cells and see where that data is coming from. So on the far right column where it says payments and the one next to it grand total, you'll see where that information has come from. So the grand total will show the sum of AHAC through SCHIP, and the payments will show the multiplied value of the grand total times the rate. And then down below, it will be the total of that entire column for AHAC and the total of the entire column for payments.
I think we might have a question.
And we might have a question here coming up, and I'll address that in just a moment. All right. How many enhancement payments will be reflected when there are various rates? That's a great question. So when we look back at this slide, you'll see that there's rates in January through April of $25.50, but it may show that in June through December, it's a different rate. Whatever the rate is supposed to be for that period is what rate will be applied during that, in that rates column or in that rates cell, and that's what we use to calculate the value. Next, I want to talk about the SFT. SFT Access is required in order to receive these enhancement files. They are large, we can't send via email, and they have to be uploaded to the SFT, which stands for Secure File Transfer. And once they are uploaded to that file, they stay for about, or to that site, they stay for about 2 weeks, and then they can be downloaded. Now, I'm going to go ahead and read through this. The action required is by no later than July 11th, that's this Wednesday. Please send an email to our unit, which you can see at this email address here, with the contact person at your clinic who needs SFT access to retrieve these files. Please include the first name, the last name, and the email address. HCA will reset each FQHC's contact's password to ensure that that contact can get in and retrieve these files. HCA will create a new username for those contacts who are not already activated in the SFT. HCA will email each FQHC's contact when the data has been uploaded. And as it says here, the data disappears after 10 days.
One thing I do want to make sure and call out for those folks that are APM4 participants, this is a different SFT server and login information than the SFT and login information that you'll have for your quality improvement scores. So please make sure and log all of your different login information separately so that you have that in a timely fashion so you can go grab these data.
Thank you, Gary. And it's important that we have this sooner rather than later because the process does take a little bit of time to complete on our end to make sure that everyone has their access. And if we're doing this for all clinics involved, then the more requests that we put in, the longer it's going to take. So please be timely with that, with completing that request.
We have a couple of questions that have come in, so maybe we'll pause now and just answer them so that we're keeping up with the content.
So the first question was about the fee schedules. For fee schedules, does HCA have any plans to make them available as data sets? Currently, they are in Excel, but have formatting which adds time to remove. We're not aware of any plans to consolidate fee schedules into data sets. Currently, our access to the fee schedules is something with the same access that you guys have. It's an Excel and it's per specific time period. There was another question, don't understand why the optometrist vision visits would not be included. They are FQHC visits. So if FQHC, as you know, in our rules and guides, there are clear definitions what constitutes a visit for an FQHC. It's a face-to-face visit by a certain provider type. And there are also certain CPT codes that are excluded from the definition of encounter. So I would encourage you to look at the definition because we have to follow federal guidelines in establishing that definition. And if it's a visit that sort of matches that definition, they would be included in the reconciliation.
What I would add to that is that if you have a vision, if you have some visits by an optometrist, you would include the MCO that paid for that. And in previous years, we've gotten the name of maybe the MCO's contracted provider for vision, but we don't have anything to correspond or correlate that to. So if it's a visit that was paid for by coordinated care, you would put coordinated care. You wouldn't put vision clinic A or vision payer A. You would put coordinate. You would include that in your coordinated care encounters. I hope that makes sense. I think we have one more question.
Right, but as long as that optometrist visit meets the definition of an FQHC face-to-face encounter by a qualified provider. There was also a question about including family planning fee schedule along with EPSDT, and it's an issue that came up to our attention recently, that there may be some family planning visits reported with using preventive the same codes that are shared with EPSDT program, but the fee schedule amounts are actually different. And it's true there is a separate family planning fee schedule on the same site that Michaela shared with you in one of the slides.
I received a follow-up question regarding the rates for enhancements for different months. And one thing I want to clarify is, well, I'll read the question. We often receive enhancement payments in a single month with various rates due to adjustments. So the entire month would not be the same rate. How will this be reflected? So to clarify what I think this question is asking is, many times we will have rates that come through for retro periods, or let me rephrase. We have client assignments come through for retro periods that have a different rate than what the current rate is. And we pay for what the rate was at that period. So in my examples, we have rates of $25.50 for this entire period here. If in June, the rate changed to $30, and in August, I received a retro file for February that would show $25.50, then the August payment summary that you received from me would show $30 for August clients and $25.50 for February clients. So that's one potential answer if that's what the question is being asked. However, there's another alternative that this could be asking, which is if a payment comes through, or I'm sorry, a client assignment comes through and we've paid for that period, and then we do retro payments back to that particular period. So if in June the payment changed, but we didn't update the file, we didn't update the rates until August, then we would submit a payment for June, July, and August at once when we do that. So if that's what you're looking at, then that's already been reconciled to the correct rate, and it would show that $30 for June, July, and August. So I hope that that answers the question either way that it could have been asked, because those are the two ways that I can interpret that. Next question, enhancement rate, is it the rate of the payment month or the rate of the roster month? The enhancement rate is based upon the month of, your reconciliation is based upon the month of payment. If the payment month, let me rephrase this, let me think about how I'm going to answer. If there was a change in scope or a rate change in June, then the effective date will be June for the change. So we would be using May or April's rosters to make the change for June's payments. I think that's all for now. So we'll go ahead and move on to the AUP section.
Okay, so this slide is about AUP findings, and I would like to start by saying that we expect for 2017 findings will be much smaller because the data is more recent. A lot of the findings that we had come up in 14 through 16 reconciliations were due to older data. So since we're in a more current period, we would expect that they will be smaller. But if there are findings on your report, auditors should assign each encounter in your report a unique encounter identifier, because that allows HCA to remove subsequent findings. So say that you have one encounter and you call that, and it has a finding, and you call it encounter A, and it shows up in the first test of your AUP. When you move on to the second test, if it were to show up again, HCA would remove that second occurrence for that finding. So that's why a unique encounter identifier is important. We've had a lot of clinics have to go back and assign those after the fact, and that takes a lot of time and resources. So if you can do that up front, that just saves everyone time. And also, if you have questions about findings, or you have findings come up that you aren't sure about, you can always contact our unit at the FQHC RHC inbox and ask us about them, because a lot of times we're able to either help clinics understand them or help find ways to lower the number of findings in your report. We've taken a pause already to answer questions, but if anyone has questions at this time, now is a good time to ask them. Additionally, after this question slide, we have several slides related to APM4 reconciliation submissions, and APM3 clinics may leave the call if they wish to. So we'll take 3 or 4 minutes to just answer some questions and take a pause before getting into APM4 specific reconciliation information.
So we got a question about treating patients that are not enrolled with the clinic or not reported in the enhancement reports. Because FQHCs basically can't turn clients away, we would accept those encounters in the reconciliation process because a face-to-face visit was provided to those clients. However, we would expect those cases to be very, very minimal. More like a urgent emergent basis, and if you continue to see that client, that you need to work with your MCO to reassign that client to your clinic.
We'll give one more. Oh, we have other questions coming in. Never mind.
There was a question about including certain diagnosis codes. I guess specific to United Healthcare, I guess we will need maybe to work with that clinic directly to understand the question. I'm not sure how that pertains to the reconciliation process.
Give folks just a few more minutes to offer up any questions they have.
Again, there was a follow-up question about diagnosis codes. We do not list diagnosis codes in the AUP, so I would again encourage you to reach out to us directly so we can better understand your question and how it relates to this process.
So another question that reads, if we already have access to SFT and have been getting monthly roster data, do we need new access? This depends on if the person who's receiving those monthly summaries from me is going to be the same person who's receiving the detail and the summary file for enhancement. If that's the same person and you already have access to the SFT, you do not need to reapply for SFT access. If it's somebody different, then please provide that new information for us. One thing that will be helpful for us so that we can keep track going forward is if we can get the username, even if you already are receiving files and not having any issues.
Okay, I think we got a correction to the question. They say, I'm sorry, denial codes, not diagnosis codes. At this time, we're not planning to make any changes to the AUP. So if you have some issues specific to your clinic that come up during the reconciliation as process of the testing of your sample of encounters, we encourage you to submit a formal letter explaining those findings. That way we can address them and maybe look at some additional data from your clinic in order to support your argument for excluding those findings from your AUP.
Okay, if there are no further questions, we're going to go ahead and move on to APM4 specific material. So any APM3 clinics who wish to leave, feel free to do so now.
So now we're going to touch on some specific information about reconciliation reporting under the APM4 model. And this will be specific to the reconciliation submission. For APM4 clinics, your templates will be divided into 2 time frames. And I believe this process is also laid out in the AUP process for 2017, but we wanted to make sure to go over it again. So your first AUP spreadsheet will be for dates of service under APM3, which is January of 2017 through June 31st of 2017. And then you will have a second template for July 1st, 2017 through December 31st, 2017. And we wanted to also address maternity care, in which you had multiple visits throughout the conversion to APM4. We would request that you split those visits and report them on the template for the corresponding time frame for which the individual visit occurred. So this is an example of what your AUP template would look like when you report the dates and the rates. I know that several FQHCs also experienced a change in scope after the conversion to APM4. That means your clinic may have 3 reconciliation templates. You'll have 1 under APM3 and 2 under APM4 for the first part of APM4 July 1st until your rate change occurred, and then a second one from your rate effective date through December 31st. Again, we would reiterate that reconciliations for APM4 clinics are due to HCA on September 30th. I believe that falls on a Sunday. If you haven't done so, please schedule your audits. For FQHCs under APM4 who have not submitted 14 and 16 reconciliations, those will also need to be submitted to HCA by September 30th, 2018. Or, yes, 18. And now we're going to open it up again to any questions for reconciliations submitted under APM4, or if there are any lingering questions related to the slideshow. It doesn't appear that there are any questions at this time, so please feel free to use the email address or telephone number if you have any questions related to FQHC reconciliation. And thank you for joining the call today. We look forward to receiving those AUPs in the coming months.
Thank you, everyone.